And welcome to our weekly COVID-19 update. I'm joined today by Dr. Lawrence Lowe, Peel's Medical Officer Health, Paul Morrison, our Commissioner of Legislative Services and Director of Bylaw Enforcement, Chief Bill Boyce, our Fire Chief, along with, via telephone, Councillor Michael Pileshi, the Regional Councillor for Wards 2 and 6. I want to start off by acknowledging that yesterday I was proud to get my AstraZeneca vaccine. The age threshold arrived for those in my age category over 40, and so I gladly signed up. Vaccines save lives. The best vaccine you can get is the first one available, and I just wanted to note that there was no adverse effects, and I would encourage everyone to get that first vaccine. It protects your friends, your family, and your neighbors. I also wanted to start off today by acknowledging I appreciate the province listened. I know there was a little bit of havoc when they announced the new provisions on the weekend. I got a lot of feedback about concerns about outdoor amenities being closed, given the fact that the science table had said that these are low-risk, safe environments for people to get fresh air and exercise. And I know that the province very quickly walked back the closure of playgrounds and is now considering what other outdoor amenities may be safe to open, and I would encourage them to do so. I really think it's important for the mental health of our residents, and glad that they appear to be listening. The next thing I wanted to touch upon today is one of my frustrations. You know, Brampton has been a hotspot, Peel Region has been a hotspot through this pandemic. And if you look at every piece of medical advice in the province, it says focus on the hotspots, focus on the areas that are facing the greatest transmission of this virus. And things are gradually getting better. Our supply of vaccine is gradually getting better, but I was looking at the data this weekend and I looked at the pharmacy rollout, and unfortunately this is another example where we're not seeing the focus on the hotspots that's merited. So Brampton has likely the highest positivity rate for a major municipality in Ontario, and I think Dr. Lowe can confirm that, over 20%. And if you look at the pharmacy allocation, right now, Brampton has 8 pharmacies per 100,000 residents. Toronto has 9. Mississauga has 10. Kingston has 26 pharmacies per 100,000 residents that are administering the COVID-19 vaccine at a pharmacy. And so I would plead with the provincial government to continue to expand the pharmacy rollout in Brampton. It makes no sense that the city that has the highest positivity rate, that is a clear hotspot, wouldn't be getting the same vaccine pharmacy resources as other municipalities that are not in a predicament as difficult as Brampton. And so I have written the province on my wishes to see that pharmacy rollout expanded even further. I think it's been very successful. I appreciate that a few pharmacies they just announced will become 24/7 vaccination clinics, and I just hope that there's more of that. I really think our residents would utilize it. I think it's a great way to get a large number of individuals vaccinated. I'm also pleased to announce today that Brampton Fire is going to be playing a new role, and our fire chief is here to answer questions about that. We are excited to announce that in the coming weeks, our firefighters from Brampton Fire and Emergency Services will be partnering with the William Osler Health System to assist in the vaccination effort by helping to vaccinate our residents. Our firefighters are nimble. They've got significant training in public safety, and there'll be more details on this rolled out, and our fire chief is here today to answer questions. But we want to make any municipal resource available to help vaccinate our residents. And whether it's a recreation center, any city property, or any city human resources, we're all in this together. And the fact that our firefighters are going to be helping with vaccination shows that the city is all in when it comes to supporting the vaccination effort. In terms of William Osler, I do have an update from our hospital partners, and it continues to be a very difficult and challenging time in the hospital. At this time, there are 99 COVID-19 inpatients at Brampton Civic, including 16 patients in ICU and another 33 COVID suspect patients. But this really doesn't show the gravity of the challenge because they are airlifting patients to other hospitals. If it wasn't for other hospitals handling the overflow at Osler Health, we would have no capacity to deal with the incoming COVID-19 patients. And so really, because Peel is overburdened beyond our own healthcare means in terms of handling COVID-19 patients who require critical care, we're in a situation that we are permanently depending. During this pandemic, we are depending on other hospitals to handle the overflow. So to say that we're at 100% capacity at Osler is an understatement. In terms of bylaw, we continue to see a high level of compliance with our bylaw and public health regulations. Only 3 charges for the face covering regulations, 22 charges for the Reopening of Ontario Act. I appreciate that our residents are mindful of the importance of the public health provisions. We're going to hear an update from Councillor Michael Paleschi about the airport, and I just want to add some context to that a year ago, at the beginning of the pandemic, Brampton City Council made a request that we close the airport, so it would only be for Canadians coming back from abroad. It continues to be a concern to our council that the airport is open, and I have concerns that variants are going to come into the country because of the high volume of activity at Pearson Airport. I know our local minister, Pramit Sakaria, has been calling for significant closures at the airport, and I would echo that call. Councillor Paleschi, if we're going to have Councillor Paleschi be brought up over the telephone to say a statement about the airport on behalf of our City Council. Councillor Paleschi?
Thank you, Mr. Mayor, and once again, I'm here today to urge the federal government to close our international borders. In recent days, we're now learning about a new variant, B1617, which is a double mutation. I reached out to a few doctors and professors in India who are studying this new variant that is devastating the country. I'd like to quote one of the doctors, Dr. Menon, who is a professor at the Institute of Mathematical and Science, who said almost definitely much more contagious and transmissible than the earlier variant. Dr. Mukherjee, who is a scientist at the Indian Council of Medical Research, who said the tests that she has done show similarities between the 2 variants to increase transmissibility and escape the immune system. I'm here today thinking about last year when I was urging the federal government to shut down our international borders. Most of us have been following the rules within our borders to get to a better place, but we won't get there if we keep our borders open. Our community, our healthcare, essential workers are tired. For our first responders, now are our last line of defense. Last week, Dr. Lowe stated we find ourselves again at a critical time where every opportunity to decrease transmission must be taken. So Brampton City Council today will ratify a motion that I've put forward asking the federal government to close our international borders. Thank you very much for allowing me the opportunity. Back to you, Mr. Mayor.
Well, thank you, Councillor Paleschi, and it's now my pleasure to introduce our Medical Officer of Health, Dr. Lawrence Lowe, who I would note has shown a ton of leadership this week. His principled approach, sophisticated, nimble approach that he announced with a Section 22 order to target our essential workplaces that are in outbreak, I believe is going to make a difference. So thank you, Dr. Lowe, for your leadership on that, and now for his weekly update.
Yes, good morning. Thank you, Mr. Mayor, for your kind words and your continued support. Morning, Chief. Thank you, Councillor Paleschi, for your update and notice as well. This week, Brampton's test positivity is at 22.4% rather, with a weekly incidence rate of 466.7 per 100,000. And there are now a record 200 COVID positive patients admitted at Brampton Civic Hospital. This is, unfortunately, the crisis that we feared. The patients fighting for their lives are our most vulnerable, our elderly, but also our essential workers who are increasingly younger and are often our newest Canadians and our racialized residents. Healthcare providers from across the province, including a friend of mine from Sudbury, continue to flow into our community to assist. But when the hospital beds run out, care will suffer, not only for COVID-19 patients, but for anyone who needs emergency help, life-saving treatment, or surgery. And this is all occurring while our cases continue to rise without pause, which speaks to our critical need to continue to stay closed, to continue to vaccinate, and then to exit. In our vaccine campaign, we are now administering nearly 12,000 shots a day at our mass immunization clinics, which is nearly 100,000 doses per week with our mobile clinics included. Yesterday, we reached a milestone of 400,000 doses in Arms and Peel, and we continue to push forward rapidly. We're expanding our mobile and community outreach offerings. This past weekend, we piloted a pop-up clinic at Sandalwood Secondary School to vaccinate special education school staff. With the lessons learned there and dependent on supply, workplace and community pop-ups will launch in the coming weeks to supplement our mass vaccination clinics and continue to reach hard-hit neighborhoods in our community. For eligibility and information and to book, please visit peelregion.ca/COVID-19 vaccine. If you are 60 plus in the entire region of Peel or 50 plus in a provincially defined hotspot, or if you're eligible according to any of the other categories on our website, I urge you, please book now and get your shot without delay. Also, if you are 40 plus, you are now eligible for vaccination through our local pharmacies, and I encourage you to check their websites and phone lines for booking. But we cannot vaccinate our way out of this third wave. The recent additions to the provincial stay-at-home order focused on outdoor recreation. And while these send a strong message to comply with the stay-at-home order, they perhaps weren't necessarily targeted at where transmission continues to occur in our community. Our essential workforce in Peel has and continues to face significant challenges in the face of this pandemic. This third wave is seeing variants spread faster and further when it finds a way into workplaces where work can't be done from home. And so yesterday, we issued an updated Section 22 workplace order, which expedites the closure of workplaces in outbreak with limited exceptions. I know that the closures may be hard on businesses and workers, but we are taking this important step now because we are seeing more and more workers who cannot work from home sickened and ending up in hospitals and on ventilators. The same workers that have bore the brunt of this disease from day one. Their need for sick pay hasn't gone away, and I'm hopeful that changes to this may be contemplated on the near horizon. But in the meantime, our new workplace order allows us to stop spread faster and investigate without racing against time. I ask employers to support this measure by making any such leave paid for impacted employees. It's the right thing to do because we all need to stay home, reduce our contacts, and get our shot when it's our turn. Even as our expanding mobile vaccine rollout targets our essential workers, these updated workplace provisions will save lives now while bringing our third wave under control. And so we will continue to close, vaccinate, and exit. That is our way to a better day. Thank you, and I'll pass it to Mayor Brown.
Thank you, Lawrence. Now for questions. Our first up is Graham Frisk from the Brampton Guardian. Graham?
Good morning, guys. Good morning, guys. How's it going?
Good.
My first question would be for Mayor Brown. You said as recently as last month that the city has taken an educate first position when issuing fines at social events and protests and places of worship and whatnot. Now that the region is switching to a zero tolerance policy for businesses that violate COVID-19, is the city going to be doing the same, taking the same sort of zero tolerance approach with events like social gatherings, protests, and places of worship?
Well, the protest will be handled by the Peel Police because the bylaw doesn't engage in protest. That's a police responsibility. But I'll have our Director of Bylaw, Paul Morrison, speak to the approach that his bylaw is taking. And I would say that we are seeing a high level of compliance. Usually there's innocent mistakes made, but the vast majority in our city understand how important the public health rules are. And for the few bad apples that are out there, we certainly hold them accountable.
Good morning, Graham. As the mayor says, yes, we did start with an education approach. When the regulations get announced by the ministry and by the premier, we usually take a couple of days to obtain the regulations because they're not always released on the day of the announcement. We understand the regulations as written, and we hope that the community starts to understand them as they start falling out. And that's sort of a 3 or 4 day process. So we educate moreover on those days. Once that education period is gone by, we start our enforcement more pointed towards the violators. So we do actually enforce harder as we go along, and we expect more from our community. But as the mayor says, we've encountered many people that are complying and that do follow the rules. Thank you.
Thank you. My second question would be for Dr. Lowe. You said people, you said people 50 or over in provincially defined hotspots are now eligible for the vaccine. When that was originally announced, I thought it was anyone 18 years or older. What has changed and why? And also, can you provide a more detailed breakdown of the patients at Brampton Civic, like how many are confirmed cases in ICU and suspected?
Thanks, Graham. I won't be able to provide you an update with the hospital. You'll have to ask them for their specific up-to-date numbers. In respect of the 18 plus, I appreciate the opportunity to clarify. What the provincial announcement was to speak that online booking for mass vaccination clinics was still going to go by the age brackets that had been identified for 60, 50, etc. And you will notice that if you go to the provincial booking site, if you are 18 or over or under 50, you are unable to book. So it is still 50 plus through the provincial booking site. The determination and criteria for 18 plus was to speak to specific workplace and community pop-up clinics where they could essentially vaccinate all comers, such as all staff on site or everyone that showed up at a pop-up clinic. But it was not intended to change the booking brackets for the overall mass vaccination clinic. So 50 plus online at mass vaccination clinics, and at the pop-ups and workups, we will vaccinate all comers, 18 and up. Thanks for the opportunity to clarify.
And Graham, that information you're looking for, currently there are 99 COVID-19 patients at Brampton Civic Hospital, 16 patients in ICU, and another 33 COVID suspect patients. But this does not tell the whole story because they are constantly transferring patients to other hospitals. So we're at capacity at Osler and have been for quite some time. Our next question is Irene from 680 News.
Good morning. My question is for Dr. Lowe. One, I'm wondering if that 22.4% positivity rate is a record, and should people assume whenever they leave home that the people around them, that there is potentially a positive case nearby? Because this is rampant community spread, I would imagine.
Absolutely, Irene. In fact, once we had gotten over 10% into the case pieces that we're having there, which really speaks to the situation across the region of Peel, that is why we have always advised people, if you're meeting people outside of the people that you already live with, assume that they might have COVID. Assume that they might have been exposed and they might be incubating. Always wear a mask, always distance, stick to the precautions as much as possible, get vaccinated where you can. I mean, that's why the message has been what it is. 22.4% just increases that possibility even more, that any interaction with anyone outside your household may result in transmission. Thanks for the question.
My follow-up also for Dr. Lowe. About the hospitals, how close are we to rationing healthcare? Because if we have a major pileup, say on the 410, the influx of patients could be huge, and it would impact people beyond COVID patients.
Irene, I think the comment I've made is that when you start hearing more and more from my colleagues and friends on the front lines, our ICU docs, our infectious disease docs, the ones that are working in the hospitals, when their voices become more prominent in the public space than mine as a medical officer of health who's in the community, I think that's a sign that the hospitals are in crisis. I think that's also a sign that the pandemic has entered one of our most severe and critical phases. So there isn't a lot more wiggle room, and you're absolutely right. I think people need to be taking this seriously. Thanks, Irene.
Okay, our next question is Sabrina from the Mississauga News.
Hi there. So my question is for Dr. Lowe. I just want to touch on the airport closure and just hear your opinion on it. So has your team been seeing higher transmission rates in Peel because of the airport remaining open? And in your opinion, would the closure of the airport, the international borders, have a larger impact on Peel's current numbers?
So I don't believe it would have an impact on our current numbers because, as I mentioned to Irene, we have widespread propagated community transmission. However, I would say looking at the border is a very important thing to do because we know that there are many other countries where COVID is raging out of control. Certainly you heard from Councillor Pleshy, and I share his concern around the picture in India. It's not even a curve, it's a wall in terms of their second wave. And I think, we really need to be revisiting and making sure that we are not introducing additional variants or additional issues into our community, especially as we're just dealing with our own right now. Thanks for the question.
Thanks, and thank you. So my next question is for Mayor Brown. So I just want to touch on your frustrations. I know the past couple of weeks you've been talking about the vaccine rollout in hotspots. In your opinion, I mean, you've said for weeks now that Brampton and Peel isn't getting fair treatment. Why is this continuing to happen?
So we've seen gradual improvement, but not certainly not fast enough. And so it just seems that whenever there's a vaccine rollout, the center of the universe is Ottawa and downtown Toronto. And I think we need to be more sophisticated in the vaccine rollout. You look at since the very first COVID-19 vaccines were administered, it was downtown Toronto and downtown Ottawa, neither area that was in outbreak. And unfortunately, I think that pattern has continued. I think given the medical advice, the physicians speaking passionately about focusing on hotspots, we're starting to see a shift. Our vaccine numbers are now closer to our population. As you know, for a long time, we were getting less vaccines than our per capita population. But frankly, it should be in correlation with the COVID cases. There was a chart that was put out last week by the Ontario Science Table that showed how many lives you can save and how many cases you can prevent based on a vaccine in a hotspot and a vaccine in a non-hotspot. And if you want to save as many lives as possible, you want to limit the spread, focus on the hotspots. And so I think there should be a correlation with cases and the number of vaccines. We're not there yet, and unfortunately the pharmacy rollout has amplified that. Our next question is Steve from in Brampton.
Oh, hi. Question for Councillor Pleshy.
Councillor Pleshy, do we have you on the line, Councillor Pleshy?
Yep, absolutely.
Yes. Considering that the virus and all the variants entered Canada through international travel, what have you been hearing through your contacts why the Canadian government continues to allow the flights into Canada?
Unfortunately, I haven't been hearing anything from the federal government on the rationale as to why. The problem is, and like you stated, I can literally book a flight tomorrow to London or to New Delhi, and I can stay for a few days, come in contact with the new variant, which we do not want in our community. We don't want any variants in the community. Test negative, fly back. Test negative again in Toronto, stay 3 days in the hotel before I start experiencing any symptoms. So unfortunately, I don't have an answer as to why the federal government has once again lifted. They closed down the border to the UK for just under a month. And I thought that was a little bit too late before the UK variant came into to our side of Canada, and I think it's time now that they need to do something, close down the borders to ensure that we fight the fight on this side with what we have.
Okay, Steve, is there a follow-up question?
Yes, just one for Dr. Lowe. And the question is, there's at least one defined business in Peel region that remains open despite current lockdown measures. Do you have the power to shut down these businesses? The city of Mississauga says they can't, and we've seen in Toronto where they actually did go in and lock up the business. What can you do in Peel region?
So we are very aware of the ongoing operation of some businesses in the region, and there are tools that are available at public health's disposal, but also at municipal bylaws disposal. To the extent that the situation continues to evolve and is an active investigation, I can't comment further at this time. Thanks so much.
Okay, our next question is Nitin Chopra from Prime Asia TV.
Thank you, Mayor Brown. Good morning. My question is to Dr. Lowe. Dr. Lowe, many of the patients are complaining that in the hospitals, those who are admitted, they said there is a shortage of certain medicines which treat COVID, kind of a tecilizumab. So is there any shortage in the hospitals of this medicine?
So thanks, Nitin. There are critical supplies of all sorts of things at the hospital at this point in time, as I understand it. But I don't have a specific line of sight into the current pharmacy inventories in the hospital. For those sorts of questions, you would be best to ask our hospital partners. Thanks very much.
A follow-up for Mayor Brown. Mayor, last year you wrote, because we know police and bylaw is working for us, we the people, and we should work for them. Last year you wrote to the Justice Department about the reforms in justice system, because the culprit is caught many of the times and they are out on bail. And now you have a 0% tolerance on any kind of activity or crime. So did you heard back anything from the Justice Department or the concerned whom you wrote?
I do have ongoing concerns about the revolving door nature of our justice system in Canada. In particular, bail reform. We've seen some egregious examples where people that were let out on bail and then committed heinous crimes in our community. And unfortunately, we haven't seen that movement on bail reform, but here in Brampton, we'll continue to push for it. And our last question today is for Nikki at the Bramptonist.
Good morning. This question is for the mayor. You've done a commendable job trying to push for sick days for essential workers. But how can the public help you be heard?
Well, I believe there's been an outpouring of public support for paid sick days. And from my perspective, it doesn't matter if it's the government of Canada or the province of Ontario that comes forward. We just need this tool for our essential workers. Dr. Lowe released I think it was several months ago, that 25% of our COVID-19 cases involve people going into work sick. It's not the magic bullet, but it's one tool in a toolkit that we need to deal with this pandemic. And so if you want to advocate, then advocate to your MPP, your MP, saying that the current services available aren't adequate. We're hearing positive news that it's about to change. We're hearing that from Christine Elliott, the Minister of Health, that the province is going to put forward a package given the fact there was nothing in the federal budget in regards to paid sick days. And so we would welcome that tool. We would welcome that protection for our essential workers.
Okay, thank you. My next question is for Dr. Lowe. What do you say to the people who are hesitant about receiving certain vaccines when it's their turn?
Thank you, Nikki. Let me be very clear. The faster we all receive a vaccine, the faster this ends. So if you are offered a vaccine, if you're eligible, take the first shot that you can get. I know there are concerns about certain vaccines in the general public. Some of those concerns, particularly around blood clots, I would say if you've ever taken a long-distance flight, your risk of a blood clot on that flight was probably higher than getting anything related to that shot. So please, take the first shot that you can. The sooner we all get vaccinated, the sooner community transmission is interrupted, the sooner we can start to loosen measures for good. Thanks for the question.
And just to add to that, Dr. Lowe, a great example that I saw online was, if your house is on fire and the fire truck's coming there with the water guns, it's not like you're going to say, I don't want that water. I only want distilled water poured on my fire. Get the first vaccine available. It saves lives. I jumped at the opportunity to get AstraZeneca when it was my chance because I really believe it protects my families, my neighbors, my community. The sooner we all get vaccinated, the sooner we're going to get out of this pandemic. So please do the right thing. Get your vaccine. That covers all our questions today. Stay safe, stay healthy, and until next week, thank you for signing in today.